Hi everyone, this is Mike from NewJerseyInsurancePlans.com. Today I'm going to go over the Part D program, that's the prescription drug program, and specifically for New Jersey residents. And I'll show you how to find the best plan for you and how you can shop the different plans and some free resources that you should be using, not only when you first sign up for Medicare, but every year at your annual election period. So to start off, I just went to my browser to Medicare.gov. And this should be a site that you visit pretty often to get anything you need for Medicare. So to start off, if you're looking for a prescription drug plan, right on the home page here you'll see Find Health and Drug Plans. So you will click that one. And while I'm going through this, you want to have the list of your prescriptions that you take each month, along with the amounts that you take. So how many milligrams? Do you take one pill per day? You know, information like that. That's what you'll need for this site. So the next thing that comes up is to enter your zip code. So I'm going to have Seeker, New Jersey, down south near Atlantic City. So I will put in 08201 and then go ahead and click Find Plans. So I'm just going to assume I'm just turning 65 and I'm not eligible for Medicaid, so I'll click I am on Original Medicare, or I will be soon. We'll leave this part blank, that's not too important. Scroll down a little bit and I'll say I don't get any extra help. So this is asking me, do I get any help with my prescription drug costs? So this is for the people that are on the lower income scale and they may get PAD or Senior Gold, things like that here in New Jersey. So for now I'll just put I don't get any extra help. I will click Continue to Plan Results. Okay, now this part you can skip if you want to, but if you do have prescription drugs that you do take, this is really important because the difference between the plans is pretty significant. There are 32 plans in New Jersey, and they each have a different formulary, so it's important to put in your exact prescriptions to make sure that your plan will have your prescriptions, and I'll show you what it looks like when we're done. So I'm just going to make a few prescriptions up that I see from time to time. So we'll put in first, we'll put Zocor, just for fun. I think that's for cholesterol. So we'll just say 20 milligrams, and for now we'll just put from a retail pharmacy. So I'll click Add. And for now we'll stay with the name brand drug, and I'll show you how to go back later and adjust this if you want to. They're telling me that there's a lower cost generic option available, but I will stick to my Zocor. So we'll click that one, hit continue, and for now we will just put in one more prescription just for the purpose of this illustration. We'll put in I see this one. As you see, when you first start typing the letters in, it will bring down a drop down box to make it easier to find your prescription. So we'll just say this lists Lanapro. Again, we'll just say 10 milligrams. It usually defaults to the most commonly prescribed one, which makes it nice and easy. So we'll say we take it once per month. I get it from a retail pharmacy. And there it is. Now, before I click to the next step, you'll want to note this drug list ID. This is great to save if you want to pull your prescription drug list up later on. So if you enter 15 or 20 different prescriptions and you don't have to do it every time you go into the site, if you save that ID, you can go back into the site and pull your list right back up, and I'll show you how to do that at the very end. So you'll save your ID. I just copied it into my clipboard there, and the date. So you want to hang on to that. So next we'll click My Drug List is Complete. And you'll see this site, it walks you through every step of the process. So even brings up the list of pharmacies in this area. So within 1 mile I have 3 pharmacies. So I will select the CVS, and let's see what ShopRite is. So we'll click those, and you'll see each pharmacy will have a different price for different prescriptions. So you want to make sure you select your pharmacy, and even certain plans will have different networks of pharmacies. The next page here, I usually just leave everything alone except I select this top one here, prescription drug plans with original Medicare, and you'll see there's 32 plans available. The next one down, these are Medicare Advantage plans. So there are 3 Medicare Advantage plans available in my zip code in Epseekin 08201, and they sell one that does not have a prescription drug card. But now we're looking at Part D plans only, so we'll select that top one and click Continue to Plan Results. Okay, we're finally done. So that took us all of 2 or 3 minutes to get through to the results page. So what this does, all 32 plans are available here, and you can actually enroll directly from the site, which is nice, and you can do it within a few minutes. But this, as it stands, is sorting everything, your lowest estimated annual retail drug cost. So what that means is over here to the left, cost as of today. So they're saying for this particular plan, if I enroll as of today, which would be, we're in March, but the plan would start April 1st, that's how much I would spend if I picked up those 2 prescriptions every month at the pharmacy. And it includes my monthly premium, would include any deductible I may have, and it includes any copays. So it has them totally sorted perfectly for me. So some people will assume that always the most expensive plan is the best one. It's not always the case, because as you'll see here, this plan is $65 per month. This is from United American. The next plan down is from Walmart, this Humana Walmart prescription plan, and that's $12.60 per month. So there are some out-of-pocket differences. So maybe I didn't pick the best example of showing you what's best to worst, but you do want to look at these each time and compare for your own particular drugs. But let's click on this first one. I do not know anything about United American, but that does not mean anything. There are so many different plans that it's important to go through each one. So I clicked on that plan, and it gives me more detail. So it tells me how I can sign up. So there's phone numbers there, or you can also enroll directly from here. So this plan is $65 per month. It has a $110 deductible up front, so that means I'll have to pay that first before they cover my prescription for me. If I pick up my prescriptions at CVS, this is how much I would spend. But if I go to ShopRite, it's a little bit more. And last and finally, we have mail order. That would be the least expensive option if I use the mail order. So you can see there is a price difference between pharmacies. So you'll want to look at your own particular pharmacies that you visit and compare them out. So I'll continue to scroll down, and it breaks everything down for you line by line. This is really nice. So the full cost of this particular prescription is $7. Moving to the right here, it's going to cost me $1. So that's very cheap. The Zocor is $195. That's very expensive, and that's per month. So that will go towards my deductible, that $195, and that's quite a bit. So we'll continue to slide down here. This will give you the monthly cost for the rest of the year. So in the first month I'll pay $261. This includes your copayment, includes your premium, includes everything you're going to pay. So this first month you're meeting your deductible, so it's more, and then month to month it's level throughout the year. Continue down here, it breaks it down even further. This one is a generic, and this one is a non-preferred brand. That's why it's so expensive. So I'm going to show you how to go back and change it if you want to see if there's something cheaper, because if that doesn't fit your budget and you can't afford the Zocor, then you should probably look at some other prescription options, or at least you can talk to your doctor about it and see what may be out there. So I scrolled back to the top, and I'm going to go back to the Enter Your Drugs page. So I clicked that one, and right here it lets me switch to this generic that's available. This one's already generic, but this one has some simvastatin. And so let's see what would happen if we changed that. So if you remember back, that Zocor is about $195 a month. So let's see if we click this one. Now you'll see it changed that to Zocor to simvastatin. So I'll go back. My list is complete. I'll keep the same pharmacies. I will click Continue to Plan Results. Go right back through the steps we went through before. Stay with the prescription drug plans to the 32. And this should actually resort the prescription drug plans out there. So we probably won't have, yep, that's correct. So the United American one fell off the charts, at least in the first few, but this Humana plan stayed up top. And look at the price difference. So that last plan was about $1,500 per year to get your prescriptions. This one's $230, so huge difference just by switching that one prescription. Now, can you switch yours? I don't know. You do need to speak to your doctor before you change anything. But it just shows you how you can change your prescriptions and save some money if that's important to you. So look at the different costs here. So simvastatin, it's $6 per month opposed to the other option. Big difference. So now I'm going to close out of this page and I'll show you how to go back and pull your prescription options so you don't have to re-enter them every time. So I'm going to open a brand new tab. Close this one, navigate to Medicare.gov, we'll go right back in like we did before, find health and drug plans. I'll put my zip code back in, 08201, and Absecon. There may be another option to do this, another way to do it. This is how I usually do it, just the same way I did the first time. Click Find Plans. Original Medicare. I don't get any extra help. And the interesting thing is, if you do it from home, you'll actually pull the same drug list that I'm doing now. You can actually look at what I did. It won't go anywhere. So on this page, this is where you can enter your drug list. And you can even do it if you're helping out a friend or family member. If they put their information in and give you the drug list ID, you can go in and actually look at what they did. It doesn't give you any information about them personally, it just tells you what prescriptions they entered into the site. So, drug list ID, paste that in there. I had saved it before. And the password date, we just did it. So it's March 30th, which is today. Click Retrieve My Drug List. And now, lo and behold, there they are. Simvastatin and the other one. So that is how you use the prescription drug website on Medicare.gov. I'll show you one more resource while we're here where it gives you all the prescription drug plans in New Jersey, and it lets you I think it lets you look at them a little bit easier. This is the site you should really use to compare the total costs, but if you want to just look at them one by one, I would use this website, which I showed in another video on finding Medigap plans. So the site is the state health insurance program from New Jersey. So we will Google New Jersey SHIP Part D. So that's New Jersey State Health Insurance Program Part D, and that's just a search here in Google because I don't know the exact address. So I know this is the actual the PDF that we want, but I'll just go right from the website. So we'll click that one, State Health Insurance Assistance Program. I got it mixed up. So you scroll down. This is all the Medigap plans sold in New Jersey. These are all the companies, which I went over in a different video, and it gives you the prices for age 65. But we want to go down and look at the prescription plans, since that's what we're doing today. So I will show you here, standalone drug plans for 2014. So go ahead and click that, and here they are. So this will show all 32 different plans that are sold, and it will break it down by they're sorted, I believe, alphabetically by plan name, not by company name. So you'll see United Healthcare above Aetna. That's just because their plan is AARP. So this is the full monthly premium. This is the deductible if it has one, and it goes over a lot of the details that you would need. The website, the phone number you need to reach. I'll go over more of the details in another video about um, the extra help benefits and things like that, and the gap coverage. But this gives you every prescription plan in the state, all 32. And I usually use it as a resource if I need to get the phone number for a company, or I just want to look at the prices overall without going into the Medicare.gov website. So anyway, that's how you find a Part D plan. And again, I recommend it for anyone just turning 65 or anyone at the annual enrollment period, which starts October 15th and will run from December to December 7th. And it can really make the difference between spending a couple $100s per year to a few $1,000s per year, just by looking at each plan and making sure that your prescriptions are on the formulary, and making sure that you're taking the least expensive one that your body will tolerate, and then will do what it needs to do. But again, thanks for visiting NewJerseyInsurancePlans.com, and have a good day.